is schizophrenia? Schizophrenia is a mental muddle which is represented by crumbling of thought processes and emotional receptiveness. It can be straightforwardly acknowledged by auditory hallucinations, paranoid or bizarre illusions, dislocated speech, or thinking aptitude pursued by social or occupational dysfunction. The warning signs initiate untimely in the adulthood. The disease is recognized to affect about 1% of human population, with about 2 million patients from the United States unaided. Schizophrenia is also known as split personality disorder, and it affects men extra recurrently in contrast to women. A number of aspects play decisive tasks in aggravating the symptoms of this disorder, and these issues are genetic parameters, early environment, neurobiology, physiological and social processes. Some drugs also contribute a petite portion in making the condition of the patient poor. Dealing with schizophrenia is stressful, not only for those with it, but also with their loved ones. It can be very difficult for them to know the diagnosis of their schizophrenic relative, particularly when it seems to come all of a sudden. Hallucinations. People with schizophrenia feel that they hear some unknown voices. They also taste, smell, and see things which are surely not present and true. Delusions. Many people fall into delusions which are not true. They feel like someone is attempting to injure them, or they feel that they bear unique and special capabilities and strengths. Bizarre behavior. People with schizophrenia behave in different manners and indulge in different acts which appear strange and unsuitable to other individuals. Negative symptoms. They have lesser interest, motive, reduced emotional locutions, and decreased cognitive operations. They are not able to express their powerful feelings. Disorganized speech. The people with schizophrenia speak in an uncomfortable way, and their speech is not understood well to other people. For an example, the sentences or the topics for discussion do not make gumption, or it appears as if there's no association between the schizophrenic patient conversation. It is for sure inexplicable to understand. Antipsychotic medication is usually applied while treating the patients of this disorder, as it curbs dopamine and serotonin receptor bustle. Psychotherapy tracked by social and vocational rehabilitation play an imperative role in treatment. In very ruthless cases, hospitalization becomes obligatory. The disorder is essentially branded to influence cognition, causing setbacks connected with behavior and emotions. Patients also suffer from depression and anxiety disorders. The typical lifespan of the patient is 12 to 15 years after the identification of the disease. If you have been diagnosed with schizophrenia, you may find coping with schizophrenia to be challenging. But first, it is helpful to have a general understanding of what schizophrenia actually is. It is always easier to cope with something once you understand it better.